All right, welcome to the deep dive. We're about to jump into something, well, pretty wild today, based on some really fascinating source material you've sent over.
Yeah, we've got clinical guides, some research papers, all zeroing in on this condition in dogs that honestly sounds a bit like science fiction.
Right, a cancer that's actually contagious. I mean, really.
That's exactly it. These sources are all about canine transmissible venereal tumor, CTVT for short. And it's a real biological puzzle. It kind of flips what we normally think about cancer on its head.
Okay, contagious cancer cell.
Yeah.
That's, yeah, that's where it gets really interesting. So our mission for this deep dive is to unpack these materials, pull out the absolute must-know stuff about CTVT for you,
Like, what makes it so different? How does it actually spread? What might you see if a dog has it?
and how do vets figure it out.
Yeah.
Plus, the really crucial bits, treatment and prevention. We want to get you those key insights.
Exactly. And maybe the most mind-blowing fact right from the start in these sources is how it's defined. It's not like a virus causing cancer. The CTVT cells themselves are the infectious agent. They spread as actual living cancer cells from one dog to another.
Wait, so the tumor cells themselves are basically the germ.
Yeah.
That's hard to wrap your head around.
It really is. Most cancers, they start from a dog's own cells going rogue, mutating.
Right.
But these CTVT cells, the sources are clear. They are essentially foreign invaders. They get transplanted, set up shop, and grow in a new host.
So it's like a cellular parasite almost, made of cancer.
That's a great way to think about it. These sources explain that these cells are all descended from a single tumor that appeared like thousands of years ago. Their clones passed down through generations of dogs.
Thousands of years. Wow.
And here's something fascinating the sources point out. The tumor cells have a totally different number of chromosomes than normal dog cells.
Oh, yeah.
Yeah, around 59 chromosomes in the tumor cells compared to 78 in a normal dog cell. It's like genetic proof they aren't originally from that dog.
So that weird chromosome count is like their ancient passport, showing they're foreigners.
Pretty much, yeah. And these ancient cells have figured out tricks, ways to sneak past the dog's immune system so they can successfully implant when they get transferred.
Okay, that is seriously strange biology.
Yeah.
So how does this cellular hitchhiker actually get around from dog to dog?
Well, the main way, as the name venereal tumor suggests, is through sexual contact.
Makes sense.
But, and this is really important in the sources, it's not the only way. It can also spread through other kinds of direct contact.
Like what?
Things like sniffing, licking, even scratching or biting the tumor itself. If live cells get transferred that way, it can spread.
So a dog could just be sniffing another dog near a tumor, maybe there's a little scrape or something, that's enough, or a bite during play.
That's exactly the point the sources make. Any direct contact where those viable tumor cells get onto mucous membranes or broken skin is a potential transmission route.
Okay, and where are you most likely to find this? Geographically speaking, I mean. What do the sources say?
They consistently point to places with lots of free-roaming dogs that aren't spayed or neutered, especially tropical and subtropical areas, just because there's more opportunity for contact.
But not only there.
No, not exclusively. One source specifically mentions cases popping up in Southern California, for example, and another notes it seems more common in temperate zones in big cities, too. So it's definitely not just a warm climate thing.
And who's most at risk? Which dogs?
Any intact dog, male or female, any breed. But the sources highlight that young, sexually active dogs, especially strays or free-roaming ones, are the most common patients, which fits perfectly with how it spreads.
Right, the lifestyle matches the transmission. Okay, so given how it spreads, where do these tumors actually, appear on the dog?
Yeah, so not surprisingly, the number one spot is the external genitals because of that primary sexual transmission route.
Makes sense.
For male dogs, that often means the base of the penis or inside the sheath, the prepuce. In females, it's usually on the vulva or just inside the vagina, often right at the junction between the vestibule and the vagina.
But you said it's not just sexual spread. So can they show up elsewhere?
Absolutely. And this is a really key point from the sources don't just look at the genitals. Extragenital sites happen, usually from that non-sexual contact we talked about, sniffing, licking, biting.
Where might those be?
Common spots are the nose, mouth, lips, tongue, sometimes around the eyes or on the eyelids, the skin itself, or even the anal area. These can be the first place the tumor appears, or sometimes, though it's less common, they can be sites where it's spread from elsewhere.
Okay, so what would an owner actually see if their dog has CTVT? What are the signs that these sources really emphasize?
The classic description of the tumor itself is often cauliflower-like,
Huh.
Or it might look like a fleshy lump on a stalk that's called pedunculated. Or just nodular, bumpy masses. They're usually reddish, fleshy-looking, firm. And a really key thing mentioned over and over is that they are friable,
Friable.
meaning they break apart and bleed very easily, even with minor contact.
Ah, okay, so that easy bleeding sounds like a big clue, especially if it's in those typical spots.
It really is. The sources stress this. If it's a genital tumor, you might see the mass itself, but often the first sign is a discharge from the prepuce or vulva, and it's frequently bloody.
Right.
Owners often report finding little blood spots on the floor or bedding. Sometimes they think it's blood in the urine, but it's actually coming from the tumor. The dog might also lick the area excessively or seem uncomfortable. And if the mass gets really big, it could even block urination.
And what if it's in one of those other places, like the nose or mouth?
If it's up in the nose, you might see sneezing, nosebleeds, epistaxis is the term, or maybe a discharge that's bloody or has pus.
Okay.
In the mouth, bad breath is common, maybe drooling. You might see the actual mass, sores, loose teeth, or the dog might have trouble eating. Around the eyes, signs could be excessive tearing. Maybe the eye looks like it's bulging a bit, or bumps on the eyelids.
Then on the skin.
Just fleshy bumps. Sometimes they might be ulcerated, kind of open sores.
Got it. So signs depend on where it is, but bleeding and visible lumps are common threads. Does the dog usually seem sick otherwise, like systemically ill?
Generally, no. The sources say systemic signs like fever, being really tired are usually absent unless there's a complication. Maybe a secondary infection sets in, or there's a blockage, or in really rare cases, if it spreads significantly, you might see a slightly high white blood cell count on blood work, but that's usually just from inflammation on the tumor surface itself.
Okay, so we have a suspicious mass, often bleeds easily, especially in those key areas.
Yeah.
How do vets confirm it's actually CTVT? What's the diagnostic gold standard here, according to the sources?
The main thing, the definitive method that the sources really highlight is cytology.
Cytology. Looking at the cells, right, under a microscope.
Exactly. It's usually a pretty simple procedure. The vet can gently scrape the tumor surface or use a fine needle to suck up some cells. That's a fine needle aspirate, or FNA.
And what are they looking for? What's the giveaway?
This is the critical insight from the sources, the absolute hallmark feature. They look for large, round cells with a fair amount of blue-staining cytoplasm. But the real key, the dead giveaway, is seeing multiple clear little bubbles or vacuoles inside that cytoplasm.
Ah, so those clear vacuoles inside the cells are the smoking gun. That's the aha moment.
That is absolutely the key feature. That specific look, those vacuoles, helps differentiate CTVT from other types of round cell tumors that can look somewhat similar otherwise. You also see a nucleus, usually in the center, prominent nucleoli, and often lots of dividing cells, showing it's growing actively.
What if the cytology isn't totally clear?
If it's ambiguous, a biopsy taking a small tissue sample for histopathology can provide confirmation. There are also specialized molecular tests like PCR, but cytology is usually enough.
Okay.
And of course, the dog's history. Are they intact? Where have they been? Any known contact with affected dogs? That all adds to the picture.
Do they check if it's spread?
Yes, staging is important. The sources recommend checking the nearby lymph nodes, usually by taking a sample with a needle. Chest x-rays are also usually done to look for spread to the lungs, though thankfully that's uncommon with CTVT. An abdominal ultrasound might be considered too, but typically it stays pretty localized.
Okay, let's shift to treatment, because this is where the sources have some really, really good news, right? Despite how weird this cancer is.
Absolutely, and this is, I think, the most vital message for anyone facing this diagnosis. These sources are unanimous. CTVT is highly sensitive to chemotherapy and is highly curable.
Highly curable. Even this bizarre contagious cancer.
Yeah.
That's fantastic news.
It really is remarkable. And the #1 treatment, the first choice recommended across the board in these materials, is a chemotherapy drug called vincristine sulfate.
Okay, Vincristine. How well does it work?
It works extremely well. Usually it's given as an intravenous injection once a week. The vet calculates a specific dose, of course, based on the dog size.
Right.
One really crucial note the sources emphasize is that it must be given carefully into the vein. If it leaks out under the skin, that's called extravasation, it can cause really severe tissue damage. So careful administration is key.
Okay. And how long does the treatment usually take?
Typically, it's a course of about 4 to 8 weekly treatments. The goal is to continue treatment for at least 2 weeks after the tumor has completely disappeared to the eye and touch. Often you see complete remission within about 5 to 7 doses.
Are there side effects to watch out for?
There can be. The main ones mentioned are potential myelosuppression, meaning a temporary drop in white blood cell counts, which needs monitoring some possible stomach upset, like vomiting or diarrhea, and less commonly some nerve issues or hair loss. But generally, it's considered pretty manageable.
What if, in a rare case, the tumor doesn't respond to vincristine, or it comes back? Are there other options?
Yes, while vincristine works most of the time, resistance can happen, particularly if the tumor's been around a long time or maybe wasn't treated fully before. The sources mention alternatives. Lomustine is an oral chemo drug that's often used as a second-line option.
Right.
Another one is doxorubicin, which is also a potent IV chemo drug. It can be effective, but it does carry a higher risk of certain side effects, like potential heart problems or more severe GI issues, so it's used carefully, sometimes in combination.
Are there any non-chemo treatments mentioned?
Yes, definitely. Radiation therapy is highlighted as being highly effective for local control. It's a great option for tumors that are resistant to chemo or maybe in tricky spots like the nasal cavity where surgery is tough.
What about surgery itself, just cutting it out?
Surgery is generally considered a third-line approach, maybe for a very small, easily removable tumor or sometimes to debulk, remove most of a very large tumor before starting chemo or radiation.
So surgery alone isn't usually the answer.
No, and the sources are really clear on this. It's a critical point. Surgery by itself has a high risk of the tumor coming back locally. One source mentioned recurrence rates like 22% within just 5 months.
Wow. Why is that?
Because the tumor is so friable, those easily bleeding cells can get spread around during the surgery itself, basically seeding new tumors. So if surgery is done, it really should be followed up with chemotherapy or radiation to mop up any stray cells.
Any other approaches?
Yes, immunotherapy gets a mention, specifically injecting something called IL-2 directly into the tumor. It's more specialized but shows promise by helping the dog's own immune system fight the cancer cells.
And what about spontaneous regression? I think you mentioned that earlier. Could it just go away on its own?
It can happen, the sources acknowledge that, but they strongly advise against just waiting and seeing. It's unreliable, it takes a very long time, like 9 months or more, and crucially, the whole time it's there, the dog is still contagious to other dogs. So treatment is almost always the recommended path.
Okay. So pulling all that treatment info together, what's the bottom line? What's the prognosis generally look like for a dog with CTVT?
The bottom line is overwhelmingly positive. The prognosis for CTVT, when treated properly, especially with vincristine, is generally excellent.
Excellent. That's the word we want to hear. Can you put numbers on that? What do the sources say about cure rates?
Yeah, the cure rates cited are really impressive, consistently over 90%. Often you see figures like 93% up to even 99% success with a full course of vincristine. Dogs that get treated early usually go on to live a completely normal lifespan.
That's fantastic. Are there situations where the outlook might be a bit more guarded?
Yes, a few factors are mentioned that could make the prognosis less certain. Things like if the dog's immune system is suppressed, maybe a very young puppy or a dog with another serious illness. Also, tumors that have been present for a really long time, maybe over a year, can sometimes be more resistant to treatment. And then in those very rare cases where it spreads to tricky places like the brain or eyes, or if there are severe complications, the outlook is naturally more guarded.
And how are these dogs monitored? During treatment and after?
During the weekly chemo, the sources recommend weekly vet visits. They'll check how the tumor is shrinking, watch for any side effects from the chemo, and importantly, run blood tests to monitor those white blood cell counts.
Okay.
Once the tumor seems gone, treatment continues for those extra couple of weeks. Then it's crucial to keep the dog separate from others, especially intact ones, until the vet gives the all clear, confirming they're cured and no longer contagious. After that, periodic checkups are a good idea just to make sure it doesn't come back.
Right. Okay, we've covered what it is, spread, signs, diagnosis, the excellent treatment outlook. Now, let's nail down prevention. How do we stop this very unique contagious cancer from spreading in the first place?
Prevention is absolutely crucial, and the single most important step, emphasized repeatedly in these sources, is sterilization. Spaying female dogs and neutering male dogs once they're medically stable after diagnosis and treatment.
That makes total sense. Stops the main transmission route, sexual contact, right in its tracks.
Exactly. Other really important things are keeping affected dogs isolated from other dogs, particularly intact ones, until they are definitively cured. Also, being cautious and maybe screening dogs that are coming from areas where CTVT is known to be common before they mix with your local dog population.
And on a bigger scale.
On a community level, the sources point to the importance of programs to control free-roaming dog populations, largely through widespread spay and neuter efforts. That reduces the pool of susceptible animals and the opportunities for transmission.
Okay, so let's wrap this up and connect it all back for you, the listener. This deep dive into the sources on canine transmissible venereal tumor has shown us something genuinely bizarre, biologically speaking, a cancer that literally jumps between dogs as living cells.
That's right. And the key things we pulled out for you are, first, understand just how unique it is. It's a transmissible cell population, almost like a parasite. Second, know how it spreads, yes, sexually, but also through other direct contact like sniffing or licking.
Third, know the signs to watch for those cauliflower-like, often bleeding masses, especially on the genitals, but potentially elsewhere too, like the nose or mouth.
And fourth, and this is probably the biggest relief, remember it's highly curable. With the right treatment, usually Vincristine chemo, the prognosis is excellent for most dogs. That's often a huge weight off an owner's shoulders.
Absolutely. Fifth, prevention is key. Spay-neuter is paramount, along with managing contact between affected and unaffected dogs.
And finally, number 6, remember that diagnosis via cytology, looking for those vacuolated cells, is usually straightforward and is the crucial first step to getting that successful treatment started. Having this info direct from the sources really helps you understand what's going on and advocate for the best care.
It really does force you to think differently about what cancer even is, doesn't it? We've just scratched the surface of the biology discussed in these guides.
It really does. The very fact that CTVT exists kind of pushes the boundaries of our usual definition. It shows that cancer isn't always just confined to one individual's body. In these rare cases, it can act like, well, like an infectious entity that travels. It really makes you pause and think, doesn't it? What else about the fundamental nature of disease or even life itself might we be looking at but not fully seeing yet?